Hi everybody, during this lecture we will be reviewing the anatomy of the paranasal sinuses. Alright, so the paranasal sinuses are large air-filled cavities. They're lined with mucous membranes and they're divided into four groups. We have the maxillary, the frontal, the ethmoid, and the sphenoid. So what are the purpose of the paranasal sinuses? Various sources suggest that they assist in vocal resonance, they lighten the weight of the skull, and they produce mucus to moisten the nasal passageways and air entering the nasal cavity. A fun fact, the maxillary sinus is the only sinus actually present at birth. Usually the sinuses will be fully developed by somewhere in the teenage age years. So to start, we'll review the frontal sinuses. They're located between the inner and outer tables of the skull, which is posterior to the glabella. They will not become aerated until at least age 6. The frontal sinuses are rarely symmetrical. So again, both of them, some of them could go super high into the skull. Some of them will be super small. As we look at pictures of x-rays looking at these sinuses, you'll tell that every frontal sinus always looks different. They're separated by a septum, which deviates from one side to the other or may be absent entirely, which would result in just a one single cavity sinus for the frontal sinuses. The ethmoid sinus, they're contained within the lateral masses or the labyrinths of the ethmoid bone. They're grouped into anterior, middle, and posterior collections. They all do communicate though. A lateral view of the ethmoid sinuses will appear that they are filling the orbits. This is because the sinuses are contained within the lateral masses of the ethmoid bone, which help form the medial walls of the orbit. The sphenoid sinus lies in the body of the sphenoid bone directly below the sella turcica. The body of the sphenoid that contains these sinuses is cubic and frequently divided by a thin septum that forms two cavities, although this septum may be incomplete, resulting again in only one cavity. Last but not least, we have the maxillary sinuses. They are the largest sinus. They're located within each maxillary bone. You might hear it be referred to as the antrum or antrum of Highmore. I definitely won't be referring it to that, but just in case you do hear that. Each maxillary sinus is pyramid shaped on a frontal view and appear more cubic looking on a lateral, as you can see in this picture on the right hand side. The maxillary sinuses are located slightly below the nasal fossa. When a patient is erect, any mucus or fluid trapped within the sinus tends to remain within the maxillary sinus, forming an air fluid level. This is usually why we perform all sinus images erect. Also, something just to note, all the sinuses do communicate with each other as well as with the nasal cavity. The osteomeatal complex, this is the drainage pathways of the frontal, maxillary, and ethmoid sinuses. When these do become obstructed or infected, it is called sinusitis. So to look at some x-rays of the sinuses, the lateral view, which is on the left-hand side, you can see that the sinuses are labeled with just letters. So F, frontal, S, sphenoid, E, ethmoid, M is maxillary. The frontal sinuses are visualized between the inner and outer tables of the skull. The sphenoid sinuses appear to be continuous with the ethmoid sinuses, as you can see in this picture, and the large maxillary sinuses should be clearly visualized in a lateral view. The picture on the right-hand side is a Caldwell view. The frontal, ethmoid, and maxillary sinuses are visualized. You will not see the sphenoid sinus because it's directly behind the ethmoid. So this is what we call an open mouth Waters view. It's pretty much just like a Waters view when we're positioning, say, the skull, but the patient is opening their mouth, as you can see, to be able to visualize that sphenoid sinus. So when we do the open mouth Waters, all 4 sinuses are demonstrated when taken with the patient's mouth opened clearly. And then we have the SMV projection. The centrally located sphenoid sinuses are anterior to the foramen magnum. The multiple clusters of the ethmoid air cells extend to each side of the nasal septum. And then usually the teeth will obscure the maxillary sinus in the SMV projection.